Well, here's how I look at it.
News Radio WAB 1180 welcomes you to The Seniors Rock Show. The Seniors Rock Show, a lively weekly discussion, shedding a bright light on aging with fun, entertainment, and important info for all adults. Join us with your comments or questions. Call or text 222-1180 or 1-800-295-1180. Now, from the News Radio WAB 1180 studios in downtown Rochester, here's your host, Joanna Palvino.
Well, hello and welcome to the Seniors Rock Show. This is Joanna, your host, and I hope you're having a good day so far. And I'd like to say welcome to my estate planning attorney co-host, Mike Robinson, who's with me almost every week and always contributes to the show. And today our studio producer is Mike Oden. So hi, Mike Oden. We've got two mics here. And when I say it's nice to see you both, it means that I want to tell the listeners, I guess I remember that you can't see them, but it's important to know that they're smiling and they're always positive. And it's good that I can see them, because something I hope you feel from this show, because God knows we've got enough negativity in the air, is positivity. And every Saturday at noon, we show up just to bring you that and to bring you up if we can, and we try. And we're glad you're here and we can spread some positivity, as our friend Fitz at Rockfox likes to remind us to do all the time. Talk about positivity. He's a great guy. And Mike, I guess I wanted to say you showed up today and you're always calm and reassuring. So thank you for that. And, we're always in good company. And today we've got two health conscious guests who practice what they preach. Dr. Laura Petrescu is going to be with us. She's been on the air several times with us, and she's also in the news, and rightly so, since she was the first direct primary care practice in this region. The DPC model, or direct primary care model of care, is becoming better known. And I know why, because as a member, and I'm a member of Athena Direct Primary Care and Lifestyle Medicine, I can assure you that there's a difference in that in regular, primary care of today, with insurance kind of, ruling the roost. One of the things that makes direct primary care different is that you get time for a frank conversation with your physician, and it is your personal physician, and you can talk about your lifestyle, and that's what it's about. It's about prevention, and it's a very wonderful thing to be able to talk to your doctor and not be rushed, and have as much time as you need to do that. And so anyway, I'd like to just welcome Dr. Petrescu again. She's going to be on here soon, and her focus will be prevention today, and how the primary care model like Athena can benefit overall health, not just treat symptoms. And Dr. Brandon Duca of Agape Physical Therapy will join us later too, and he enjoys working on shoulders, low backs, and knees, and with the athletic population. So I bet some of you out there can relate to those body parts. I sure can. And today, his topic, Dr. Duca's topic, is going to be pain science and how it's integrated into physical therapy. So I can't wait to hear about that. I do have two new hips myself, and I did go to Agape Physical Therapy. I tell everybody they are wonderful, and they are so dedicated to helping, you while you're there, and also afterwards. The aftercare program that they suggested has been working great for me. So, even though our bodies change as we age, that doesn't have to be a bad thing. That's what I think. And I've learned that. And, you can fight it all you want. But today, these two experts that we're going to have on are going to share ways that we can use to be our best selves at any age, and to hold off some of those challenges that many older adults face. So, I was going to, mention one of the things I know Mike does, Mike Robinson, he uses meditation, and that's life changing for him. And it has been, and he tells me about that all the time, and has told our listeners, it's a good example of a simple thing that led to unexpected benefits. So talk about unexpected benefits. We talk about the health benefits from having clean air ducts around here lately, because I did have that done. And, but I don't think we've mentioned energy efficiency. Yes, clean air ducts can help your HVAC system run more efficiently, reducing energy consumption and lowering your utility bills. That's a good thing. Indoor air professionals can make your home more efficient, just like they did with mine and ours, I should say. And if you call today, you'll save cash. Wanted to mention that because it's $160 off of air duct cleaning. Contact Western New York's air duct cleaning experts, Indoor Air Pros, right here in Rochester, and save on duct cleaning. Healthier air means healthier people and energy efficiency. So they're also offering our listeners $350 off the portable medical grade air purifier by Healthway. And wait a minute, a whopping $500 off the whole house unit. Please call our friend Peter today. Take care of that air in your house and breathe better and save money. 585-427-8020, and he's at extension 303. Again, breathe easier, save money, and dust less. You won't regret it. I can tell you that firsthand. Call Peter today at 585-427-8020, extension 303. And you can learn more and a lot more about clean air at indoorairpro.com. Now, I hear that music, so that means we're going to go to break. Please stay tuned because we're going to have Dr. Laura Petrescu with us next. She always has great tips, and you can follow them very easily at home. So stay right there. We'll be right back. Welcome back to Singers Rock Radio, and I hope you're enjoying the morning or what? Wait a minute, it's the afternoon. And we are back, and right now we have Dr. Laura Petrescu with us. She is one of the most popular guests we have on the air, and we get listeners' comments quite often, and from ourselves even, about the great and easy health tips that we've gotten from her over the years. And she truly believes food is medicine, and that being conscious of everyday choices is the key to good health. Founder of ATHENA Direct Primary Care and Lifestyle Medicine. Thanks for joining us again, Dr. Petrescu. Hello, how are you?
Hi, Joanna. I'm glad to be back on the show with you. Thank you for inviting me.
Oh, it's so good to hear you. And every time I hear your voice, I'm reminded of all the good things that I've learned from you. And there's a lot of attention these days on medical research and in medical research that's geared towards precision medicine. So you know how I am. I need to know all about this. So there's lots of myths and confusion about this topic. What is precision medicine, doctor, and why is it important?
Yes, precision medicine is a hot topic these days, and I think it takes personalized medicine to the next level. And I think, by now, as a lifestyle medicine physician, I'm very, very passionate about prevention and how to stay healthy. And I think precision medicine is the intersection between taking account the genes, the gene makeup of individuals, as well as their epigenetics related to lifestyle and environmental changes. So it really takes future medicine into the future to help us really understand disease and wellness in humans. So I think in the next 20 years, we're going to hear more and more and more about how to do more individualized treatments using precision medicine and bioengineering and genetics.
Very good news. That is great news because there are a lot of things we need to look at. And of course, cancer is one of them. And doctor, traditional cancer screening seems to be very limited, only targeting 5 organs, I understand. There's the breast, colon, prostate, cervical, and lung cancers. How about the rest of cancers? What options do we have for those? And please help us to understand.
Yes, absolutely. So we have the well-established 5 cancer screening sites. But how about the rest of the organs? The brain, the skin, the eye, the liver, the pancreas, all the other organs that we know the incidence of cancer is high, and the death from those cancers is high, and we have really no means of screening, and we only go by symptoms. And we know in terms of cancer, when you have symptoms, it's a little too late. So since the finalizing of the Human Genome Project back in 2003, now we have more and deeper understanding of the human genome and genome sequencing and how we can leverage that science to detect cancer early. And just a little over 10 years ago, it was just a dream to think about there is a blood test that can tell us whether or not you have cancer and to avoid, and all the other cancers, right? So think about
Wow.
50 plus different types of cancers that we can look at and detect early and not talk about, the radiation that goes into a mammogram and not talk about the prep that goes into colonoscopy. How about, that would have been a dream for us back in the day. Is there such a thing as a blood test? And I think we're getting there. It's pretty incredible. So it's just new science. Back in 2020, the telomere to telomere consortium finally got us to really understand every sequence of the DNA. Now we can use that information to detect cancer early. And that's pretty incredible news. Obviously, we're talking about the future. We're not going to look at Medicare and Medicaid and the government to pay for newest science to be standard of care. And I'm hopefully optimistic that this will become common practice, but perhaps, not in the next 5-10 years. But it's pretty incredible news that we have simple blood tests and such technologies to answer such important questions, 50 plus cancers. So looking at, probably you've heard of the Galleri test and the wonderful work that Grail company is putting into understanding genome sequencing and early cancer detection. So that's wonderful news. And, I think we're going to hear more and more about this, and I want our listeners to be aware and stay informed, because as a direct primary care physician, I'm all about, proactive care and not necessarily waiting to get sick and develop symptoms, but what else we can do to prevent illness and disease.
Thank you, Doctor. And Mike's got a question for you.
Yeah, hey, doctor. I'm just going to, who is at risk for cancer and how do you determine best treatment?
Yeah, interesting, right? So we used to say, every decade of life, 15 years are the higher risk of cancer, but now we know.
Doctor, I hate to interrupt you, but we are going to news. It's a hard break, so we're going to have to go. But people, you can learn a lot from Dr. Petrescu at ATHENADirectCare.com. You can also call her at 585-662-5510. She has plenty more to tell you, and I can tell you that for sure. So please call her and go on ATHENADirectCare.com and learn more about this wonderful model for is a physician's office for you. It's a great option, and we'll be right back after the news.
Welcome back to Seniors Rock Radio, and welcome now to another expert from Agape Physical Therapy. You'll find Dr. Brandon Duca in the Greece location of Agape Physical Therapy. He's the assistant clinical coordinator there. Brandon says he enjoys working with shoulders, backs, knees, and the athletic population. And Brandon's topic today is an important part of physical therapy, pain science. Interesting topic. And Brandon, thanks for joining us.
Hey, thanks for having me.
Brandon, pain obviously is a relevant component of your practice. What are some common misconceptions about pain that you typically hear?
So I think one of the biggest misconceptions I hear about pain is that it's equivalent to the amount of damage in your body. So a lot of times people will say, oh, my knee hurts really bad, and therefore it must be really bad from a structural standpoint. And the reality is that's just not the case. We oftentimes experience pain and all types of sensations, even in the absence of any pathology. So oftentimes in my practice, I'll have people come in who have confirmed significant arthritis in their knees from an x-ray, and they don't have any pain at all. And then I'll have other people who have very minor changes in their body shown on images, and they're in a lot of pain. So if you're someone who's maybe avoiding activity or seeking care because you think that your pain is going to get worse and thus your tissue pathology is going to get worse, well, you can be rest assured that, pain and pathology don't often go hand in hand.
Interesting. And how can therapeutic exercise help with pain?
So when you see a physical therapist, the first step is determining what the source of the pain is. So we'll work on things like range of motion, strength, correcting movement dysfunction. But even aside from that, simply exercising in and of itself can be very therapeutic for pain. And the reason for that is endorphins. So endorphins are what our bodies release, is a natural pain-killing substance in response to any sort of exercise. And so if you're someone who likes to go for runs, or someone who likes to run, and you get that runner's high afterwards, that's all endorphins. And so it doesn't take a lot of exercise to get this endorphin release. Any amount of exercise can be very therapeutic and very pain relieving type of mechanism of reducing your pain.
Excellent. And I'm here to tell you that it does work. And I was a patient there at the Greece location where Brandon is also working, and they taught me that. And I didn't grow up doing exercise. We just weren't in that, that women weren't doing exercise all the time in the 60s and 70s. We were doing other things like, what were we doing? We were protesting. No.
There you go.
Anyway, but listen, I have another question. When someone has an MRI or an X-ray and it shows pathology, is that necessarily the source of their pain, doctor, or are images a reliable way to determine where the pain is coming from? Can you always tell?
Yeah, so, Joanna, in a lot of cases, you do have to take your images with a grain of salt. Now, obviously, your doctor will let you know if it's significant and it requires, some form of medical management, surgeries, medications. But in a lot of cases, our image results simply just show age-related changes. So I like to cite this study all the time. They did MRIs on people who are asymptomatic. And so these were people who did not have any pain at all. And they found that a vast, vast majority of us are walking around with significant pathology in our spine, and they don't even realize it. And so I think the study suggested that people in their 20s, about 33% of people in their 20s are already showing signs of arthritis in their back, and they don't even realize it. So, yeah, to answer your question, no, you can't say, oh, I got this in my back and it was shown on an X-ray, therefore that's why my back hurts. You have to just take it with a grain of salt in a lot of cases.
Wow, very interesting. I'm going to share that with some people in my family that are having some pain, and it probably started quite a while ago. Now, do you have any general advice on pain prevention for everybody in general?
Yeah. So good question. I would say if you have pain, obviously reach out to a physical therapist because we can help with that in a lot of different ways. But to answer your question about prevention, I always recommend that you join a gym and you do some form of exercise. And so I'll have a lot of patients say, hey, I walk my dog, right? I go to the gym and I go on an elliptical. And those are fine. And I don't want to discourage people from doing that. But really the best bang for your buck is going to be strength training. So it doesn't need to be intense. You don't have to think, oh, I need to bench press and squat heavy and deadlift heavy. Any amount of strength training is going to be really, really good at preventing a lot of these, musculoskeletal aches and pains that come with the aging process.
Wow. Now, you are excellent in helping people at the Agape offices. You have several of them. Everybody can find one near their home. I know that. But do you have anything, maybe a tip for folks who are at home and think maybe I should start some strength training? Is there anything you can do at home?
Absolutely, yeah. Something just like standing up and sitting down from a chair, right? That's exercise, and it's very easy. Most people have chairs in their house. Just doing 11 sit-to-stands per day has actually been shown to drastically increase quality of life in people. So anything just like walking, around your block, standing up, sitting down from a chair, you can invest in some very cheap dumbbells, and you can do a lot of stuff with dumbbells from the comfort of your house.
Yeah, there's a lot of really cool ways to utilize those chairs too. I've seen, like you said, the just standing up and sitting down. I learned that at Agape, and also some other things that I was with Pat there, and I remember seeing you there, Brandon. It was awesome, and what a
No, I
great team
remember
you
you
are.
too.
And yeah, and I've had two hip replacements, as I said earlier, and you helped me through both of them. You're Agape in Greece, but it was amazing to me how also I was given information on what to do when I left there, when PT was done, keep going. And I got that encouragement. So that was really excellent. I want to thank Pat over at the Greece location for that. But I do know that I've met many people at Agape in all the different locations. In fact, we're probably going to do a remote there this summer, maybe out in Brockport. We've talked about that. We did that last year. But it's always a delight to talk to you folks. And so, Dr. Brandon Duca, am I saying that right? DUCA,
That,
Duca?
yep, that is correct.
Thank you. I should have asked earlier, but you can find Brandon at Agape Physical Therapy's Greece location or another location near you. They're all great. And you can call Agape at 889-7777. That's an easy number. Thank you so much for joining us, Brandon. It's great to hear you, and thanks for the tips.
Thanks for having me so much.
Yeah, we'll have you back again. And folks, stay right there because we've got more Seniors Rock Radio coming up on News Radio Wham 1180.
And welcome back to Seniors Rock Radio. And Joanna, another good show. Great information from our guests. And I wanted to mention something. As you know, we've joked around, but it's a serious topic. We talk about the need for folks to talk about death.
Absolutely.
And that's important for families. And this coming Friday, the 19th, at the Record Archive, they host every Friday from 4 to 7. They call it the Finally Friday Happy Hour, and
Oh, yeah.
they do
With
different
Dino,
things.
right?
Dino Kay hosts that, and Elena Alderman, who's vice president over at Record Archive, is always involved. And it was Elena's idea for us to host a conversation about death. And the title is Let's Talk About Death, a lighthearted conversation about a heavy topic. So, folks, if you're free on Friday afternoon, come on down to the Record Archive. We're going to keep it light, but it is an important topic, and I'd encourage you to come out.
So you're going to take questions, that kind of thing?
Absolutely. It's going to be not very structured. We want it to be comfortable, conversational, and we'll talk about what folks want to talk about.
And I have a feeling there might be some Grateful Dead music involved.
That's, if I have anything to say about it, yes, I think there will be.
You
And
might
that
be
would
able
be
to throw.
appropriate.
How about Dead Roses from the Rolling Stones for me? You could throw that in.
All right, very good.
All right.
Request taken.
Thank you. Thank you so much.
Yeah.
What else
So-
is happening?
Boy, well, I'll tell you, just windy and wet, right? My goodness, what a crazy past several days it's been.
I'll say. But everything's popping out there. I see pink, I see green. I'm very excited. So bring
Oh,
the rain
yeah.
on, bring that sun. And this coming week, we're going to have some beautiful flowers and things to look at out there. So I'm all about it. I don't mind the rain. In fact, I like going places in the rain because no one else goes out.
There you go. There you go. And we can use it. We can use it. We'll be glad this summer that we got it.
You got it. All right. And well, what else? Do you want to give any closing thoughts?
Well, just as always, I hope folks enjoyed the show, and I hope everybody has a good week. And I always encourage people to be well and be kind.
Absolutely. Today is National Catch and Release Day, National Peach Cobbler Day, National Make Lunch Count Day, and National Scrabble Day. So, folks, whatever you do, have some fun. And, we talk about serious things here on the show every week from noon till 1. And we hope you'll join us again. Tell your friends about it. And this weekend, I wanted to mention real quick, you can support the American Red Cross. And it is national blood shortage time, and it's really bad. So they're asking us to come out and become sickle cell fighters at the Sickle Cell Fighters Blood Drive. That's today and tomorrow. It's at the Ryan P. Thomas Community Center at 530 Webster Avenue. And if you go to redcrossblood.org, you can schedule an appointment to do that, to give blood and to help. And you can complete the free health screening that's there. It's redcrossblood.org. The key word is sickle cell fighters ROC. So they're offering a nice incentive too, besides the fact that you're helping the Red Cross, and who knows how many people. Each donor gets a $20 Amazon gift card and a Sickle Cell Fighters t-shirt, so you can be part of the group. So check that out. And if you're in a giving mood, the local fire departments, Mike, are in need of volunteers, and that is everywhere. So they're all going to be open today and tomorrow, and they're saying, come on down if you want to learn about volunteering or volunteer. Either way, check out the fire departments and let's help them because they help us all the time. And tune
Very
in next
true.
week. Yeah, and we can't forget about them. We just think, oh, we call for help and they're going to show up. Well, no, we need people to do that, and we need to keep fueling that. No pun intended, that fire. So, wait, that wasn't a good thing to say. Anyway.
I know what you mean.
Anyway, I hope you have enjoyed the show today, folks. And next week, we've got a great show planned as well. We're going to learn a lot about your home and how to make it really good and efficient, I guess is the word. We're going to have Peter Gordon from Indoor Air Professionals, Jeff Flaherty from Wise Home Energy, and I think Mike Mateo might be joining us too. So we've got a lot going on next week. Tune in, please, and tell your friends, as I said. Mike, anything else you want to say before we go?
No, hey, folks, just again, thanks for listening. Have a great week.
Yeah. Thank you to Dr. Petrescu and to Brandon from Agape's Physical Therapy. And you can reach them, as I said. And you can actually, any of our sponsors, you can find them on seniorsrockradio.com. Please visit them because they're supporting the show. And we are a unique show all about you, all about our community and our families. And, of course, about seniors, because we do believe that seniors rock.